Those who are vaccinated, and particularly those who are boosted, while yes, they can have breakthrough infections, these infections tend to be much more mild. Now, meanwhile, those who are not vaccinated, those who opted against the protection of the vaccine, whether due to misinformation, misprioritization, or other societal barriers, do so much worse. The vaccine is very often the difference between whether you go home to lay on your couch and watch movies, or you're admitted to the hospital, given steroids to decrease the inflammation in your body, laid face down to try to redistribute the fluid that builds up in your lungs, and put on oxygen to keep your organs functioning. 635 people are currently in our hospitals in the county with COVID. Now, I hear a lot of questions about, are they there with COVID or are they there from COVID? Is COVID your main reason for being admitted? I'll tell you, of the many, many patients that I've admitted who were COVID positive, I can't think of one where their COVID positive status will not adversely affect their ability to recover and go home and leave the hospital as soon as possible. COVID infection may exacerbate other chronic conditions such as heart disease and kidney failure. So right now, COVID is affecting these folks, but also so many more, either through the health system capacity issues, which is limiting access to otherwise routine care, or through school closures resulting in virtual education, or through airline or restaurant or other business closures or limitations due to the impact of COVID. This surge in cases is unlike any we've seen in the last 21 months of the pandemic. And how our health systems can maintain operations will remain a challenge in the face of this influx of cases. Vaccination and boosters are critical to protect you in the weeks and months to come. And in the short term, masking with a KN95 or N95, as well as distancing, will be critical as we yet again look to flatten that curve and blunt the impact of this wave of infections. We will get through this, but we must work as a community to ensure we emerge on the other side as safely and healthy as possible.